Welcome to NARAL's The Morning After. Each Thursday, our podcast brings you the latest on reproductive health care, progressive politics, and the fight to keep abortion safe and legal. NARAL's The Morning After is a production of NARAL Pro-Choice Ohio. Find us on Facebook, Twitter, and Instagram at ProChoiceOH. Enjoy the show.
Hi, I'm Gabe.
Hi, I'm Randi.
And I'm Jaime. So this week was another fun, exciting, crazy week around here. Hopefully the last one of these for a little while because the legislature is finally gone. Praise whatever God you praise or whatever God you don't praise. But they couldn't just go away. They had to go away with a bang. So the Senate did pass the Senate version of the fetal tissue disposal bill.
Right. One of the three bills
Yes.
to work on this.
Mm-hmm. And, it's funny because the Senate bill started out the same as one of the House bills. So House Bill 417 and Senate Bill 254 started as the exact same bill.
Okay.
Both of them got amended, and both of them were amended in completely different ways.
Weird.
So if you can't agree on how this should be regulated, maybe that's a sign that you shouldn't regulate it because you have no freaking idea what you're doing.
Right.
Just a thought.
Right.
Just a thought.
It's not going to stop them. Maybe.
It's not, because that never stops them, because facts and science don't help.
Yeah.
So the Senate passed it. The ACLU testified this week. They were unable to come last week when the hearing was. So the ACLU did weigh in this week against the bill as a violation of privacy and a whole bunch of other things. So we were thankful for that. And then, of course, they made one small amendment to the bill because they keep talking about how it gives the woman a choice on how the remains are disposed of. It doesn't make her make the choice, but the way the bill was written before, it said, well, she has the right to make the disposition decision, but then the clinic can't get rid of the tissue unless the disposition decision is made. It's not a choice that's forcing her to do something. So they did actually amend that piece out so that the clinic can dispose of it if the woman declines the choice to make the decision herself. So, but it's still a disastrous bill. It still requires burial or cremation, goes against all medical standards for the disposal of biological tissue. And really is just like all the other bills, like we said over and over again, just another way to close down our clinics. So, so they're all gone now. So we've got the two bills sitting in the House.
The legislators are out for the summer.
Yes.
They're all gone now.
Well, the summer and actually most of the fall. Sometimes they come back like once or twice in September, but they don't even expect that to happen because it's going to be such a crazy election year. So we will hopefully not see the Ohio legislature back until after Election Day.
Right.
At which point we will have 6 weeks of holy hell, also known as lame duck.
Right.
Where God knows what will happen at that point.
Right.
Yeah.
Yeah. I mean, it really does sound like they're going to take the entire summer and that early part of the fall because, every single member of the Ohio House and half the members of the Ohio Senate are up for re-election. And they're all trying to figure out what it means to run down ticket from Donald Trump. So they're probably not going to want to spend time sitting in committees.
No.
Adios.
Well, and it's funny because they even have some races that they're going to have to figure out what to do with too. There are several cases. There's one, I think it's House District 74. It was a 4-way Republican primary, and the candidate that Ohio Right to Life and the county Republican parties all endorsed didn't win. This guy who basically ran on, I'm going to reverse gay marriage and pass the heartbeat bill was his platform. He's the one who won. So they've got even a couple of those that they're going to have to figure out themselves what to do with this election season because those are not candidates that represent Ohio values in general, even in our gerrymandered districts.
Right.
That puts some of those districts in a little bit more danger than they would have been with a more moderate Republican. So yeah, we'll see.
I don't even understand, that's not even possible.
Again, Randi, logic.
That's why Donald Trump says he loves the poorly educated.
Yeah. Because they believe that Donald Trump can do all the things that he says.
Yeah. I mean, and it's like, that's what you want to be associated with, someone who calls you poorly educated because you don't know any better. That's why you're voting for him. Okay.
Exactly. So
just to restate that timeline, they're out of session for the summer. So that Memorial Day weekend begins their summer of campaigning.
Yes.
They're going to take June, July, August, September, October to campaign.
Yes.
So we've got that amount of time to be talking to our friends and neighbors about these sort of abortion restrictions, and why they're being passed, how they're not based in any sort of evidence-based, medically necessary set of guidelines. These are just willy-nilly restrictions that the legislature is pulling out of thin air of different ways that they can dream up to try and attack abortion providers. The Supreme Court will make their big announcement in Whole Women's Health at the end of June.
Yep.
So that'll give us some sense of how to reframe that conversation and then keep talking about it through the summer to Election Day.
Yeah. And then take a week, Wednesday, Thursday, Friday, Saturday, Sunday, Monday after Election Day to sleep and be ready that Tuesday for the Ohio legislature to come back for 6 weeks of holy hell.
Right.
Where we expect to see votes on these fetal tissue bills. I wouldn't be surprised to see a vote on the 20-week ban, the Down syndrome ban. I mean, they've got so much still pending out there. And who knows what they'll even dream up to come up with new over the summer. So, we all think we just got to make it through Election Day. No, actually, we need to make it through mid-December. They'll probably be in session until at least around December 15th.
Yeah.
If not a little bit later. I mean, they've gone to like the 22nd before and totally screwed up my Christmas. It's been a pain.
And, it's kind of interesting to see, not like good interesting, how legislators handle lame duck, because some of them, especially if there's a bad election season for one caucus, they are either going to come back and say, okay, the voters have spoken. They don't want us in power. We're not going to try and rock the boat right now. We're just going to step out quietly. Sometimes. Other times they come back and they say, well, there's no more consequences. Let's just burn everything down. And that's more of what we've seen in the past few lame ducks. So
yeah, and it'll be really interesting to see too, if this election cycle does go down in the way that we would hope and dream it would, which is that, Donald Trump kind of just takes the, crazy road that he's currently taking and, takes the Republican Party down with him. And what does the establishment do with that? Because, he's this anti-establishment candidate. Does the establishment come back saying, look, we let you have a chance. We're going to take back our strong-armed control of the party, or do the crazies kind of hold out? Because I think that'll really depend on what we see happening in lame duck. I mean, the last crazy lame duck we had, session was delayed until like 2:00 in the morning because one of the really crazy legislators, back again, Tom Brinkman, was trying to get his total and complete abortion ban thrown into another bill at the last minute. And this was a bill that had no exceptions, even for a woman's life. It was if the doctor inadvertently terminated the pregnancy was the only exception to the bill.
Inadvertently?
Yeah.
Like
so
medical
if I
error.
slipped and here's this mifepristone that accidentally fell into
we
your
finally
hands.
figured it out. There's in the crazy OBGYN, like not established OBGYN community, the pro-life OBGYN group that Patrick Johnston runs out of Zanesville, Ohio. They believe that it's better to remove the diseased organ in the case of an ectopic pregnancy. So in an ectopic pregnancy, you could take mifepristone, you can do like medication abortion and resolve it, and it works swimmingly a lot of the time. Or you can go in and do a surgical procedure to actually remove the fallopian tube where the egg has attached. And they say that that's the preferred method because you're removing the diseased organ. You're not intending to terminate the pregnancy. That's what we think that was probably around. Yeah, Gabe's face, if you're listening, is one of complete bewilderment at the moment.
I mean, did they use bloodletting and leeches and
well, actually,
throw her in the river, and if she floats, she's a witch?
So
Dr. Johnston actually
pregnancy, we're gonna make it even harder for you to ever get pregnant again.
Exactly.
And that's pro-life. Like,
but the real crazy thing about Johnston and ectopic pregnancy is he's got a whole article. He's a doctor in Zanesville, Ohio, by the way. He's like a licensed medical practitioner in Zanesville, Ohio. Do not ever go see him. He actually has an article out there about how the vast majority of ectopic pregnancies resolve themselves on their own. And we don't even need medical intervention for this thing that kills women. Seriously? So that's what we think they were kind of saying with that inadvertent. But yeah, they tried to shove that in at like 2:00 in the morning, and supposedly there's a big, huge fight in caucus and everything else. So anything can happen in lame duck. So get some sleep between, Election Day and the Tuesday after, and then be ready to come roaring back with us for November and December. And then you can sleep between, Christmas and New Year's.
Right.
yeah, pretty much.
So yeah.
They're always very interesting.
They are.
But some really good news this week. A federal judge blocked the defunding of Planned Parenthood. Thank you, Gabe.
Get up on the
A
mic.
federal judge this week. What was it? Was
Monday.
it Tuesday? Oh, Monday. Okay. Blocked the defunding of Planned Parenthood, which it was going to be really bad for a lot of the county health departments. Because I was reading an article about that last week that Gabe shared. And it was just like really crazy, all the scrambling they were going to have to do to try to like now find somebody new to provide all these services, none of which that had to do with abortion.
Yeah.
Even though obviously we need that. But this is, it had nothing to do with that. And they were going to have a hard time, filling all of the service needs. And so the judge this week, that's what he said, / that's what she said. So this is what the judge said in his ruling. That's a violation of the First Amendment, as Barrett explains. The unconstitutional conditions doctrine provides that the government may not deny a benefit to a person on a basis that infringes his constitutionally protected freedom of speech, even if the person has no constitutional right to the benefit itself. That is, the government isn't obligated to offer funding to Planned Parenthood, but if it does do so, it cannot condition this funding on Planned Parenthood silencing itself.
Yeah. And that really comes from the fact that it wasn't just a defunding of somebody who provides abortion care in Ohio.
Right.
It was that inclusion of promoting abortion. So that's what they really based that on, and the fact that saying that you can't even talk about it is an infringement on their constitutionally protected freedom of speech, which the antis scream about outside of clinics every single day. You can't have a buffer zone because that infringes on my freedom of speech.
Yeah.
But silencing Planned Parenthood seems to be just fine. Like you can't have rights that you'd say nobody else can have. That's not how this works.
They want to be able to scream in the face of people about abortion, but they don't want doctors to be able to have a nice, calm, rational conversation with the patient who's come to them with questions.
Yeah, exactly.
That's somehow promoting abortion and therefore a cause for defunding.
Yes.
Yeah.
Goofy.
Okay.
So yeah, but that's only a temporary. It's only through June 6th. So it really only lasts for 2 weeks. They have a longer standing application for a longer injunction for the course of the case. So we'll keep everybody posted on what we hear on that front.
Right.
So.
Okay. So the other thing that happened this week is we got to see a presentation by our lead researcher, Erica Duff. She's been working diligently over the past few months, to put together a report called The State of Choice in Ohio. Folks can find this on our website at prochoiceohio.org in our state section. And, this was a very comprehensive look at all of the different factors that are involved as Ohioans seek access to reproductive health care and abortion rights. So she did talk about the attacks on abortion providers that we've discussed many times on this podcast before. Governor Kasich enacting 17 different restrictions on abortion providers, including cuts to funding, the closure of 8 clinics across the state, taking the number from 16 to 8, and now it's up to 9. But, we've lost half of those clinics that were, in existence, available to women when Kasich took office. So she looked at all of that, and then also really sort of went in depth looking at the effects of prenatal care and who has access to that. The disproportionately affected populations of women of color, Black women, Latinas, who don't have the same access to prenatal care that the white women do, and then what that really means. Ohio is 44th in the state in terms of infant mortality. Lack of access to prenatal care is a big factor. An absence of paid family leave is another big factor in that. She looked at how there's pretty much no data on how we deal with transgender citizens and how they access healthcare.
Really,
and pointed out that
interesting.
almost all the healthcare plans really sort of depend on the male-female binary. And if you're, not solidly in one of those categories, the healthcare system really sort of fails you. And then also she talked about women in prison and how that's really sort of an invisible population that, we neglect to include in access to healthcare. Not just in terms of access to more day-to-day reproductive health care, but also the horrible practice of shackling women to beds while they're in childbirth. They get unshackled at like the moment of delivery, but then as soon as that baby comes out, they're shackled back to that bed. So many aspects, really comprehensive. And it's all boiled up in the survey. So like I said, you can find it at prochoiceohio.org. We had a great presentation from Erica. Many members of the General Assembly and their staff were present for the presentation, and then the press got a conference call later in the day. What were you guys' takeaway from how that all went?
Oh, I thought the turnout was really good. There was a packed room.
Yeah.
So that was exciting. I thought, I was really surprised by that. I guess I shouldn't be, that we didn't really have any data on transgender people and like getting healthcare to them. Because, we did a trans health panel back in January.
Right.
And so, but I guess they were saying similar things, that it's kind of like certain people are like taking strides in their own practice to try to be more inclusive and try to learn more.
Right.
So it's still, sort of, I guess I feel like it's a new thing for all of us. It's not necessarily a new thing. Like,
right.
I mean, there's been transgender people for hundreds of years, I'm sure. Probably thousands. But it's just like a new thing to us. So now it's like, oh, okay, well, now we're like, all of this is happening, and now we have like lots of celebrities. So now it's like a interesting thing to us to like learn about, which, I mean, I guess that's not necessarily a bad thing, because it's making more people interested in learning about, about those things. But
you're right. It's individual doctors that are sort of choosing to take that on.
It's not
to start
like
making an inclusive practice. It's not a
thing
standard
that they have to learn about at school.
Right.
Well, and I think it's interesting too, the parallels between the repro rights and the LGBT rights communities, and how you gain access to something through the courts. Roe versus Wade for abortion, and Oglefeld and with gay marriage. And then the kind of most at-risk population gets attacked first. With Roe, you saw the immediate passage of the Hyde Amendment, the very next year, and blocking low-income women from getting abortion coverage through Medicaid. And, I think the trans community is really becoming the brunt of attacks, the rebellion against the gay marriage. I mean, so, and the number of attacks have gone up. This whole Target bathroom thing, all of our anti-choice people who protest outside of abortion clinics are now protesting and harassing and annoying people in Target too. And it's just the parallels between how, the backlash goes, against, the most vulnerable populations in so many of these things. The other thing I really took out of it was the section on child welfare. There isn't a lot of good data on adoption and foster care and that kind of stuff. But the fact that Ohio is dead last in state funding for our child welfare system, terrible. Like 4% of the money comes from the state money, and the rest comes from local and federal grant
we get
dollars.
9 cents on the dollar. The national average is 43. That's a big difference.
Yeah, that's a huge difference. And, again, just shows how ridiculously stupid our state legislature is, and talking about how pro-life they are. And then they give 9 cents to the dollar to actually take care of kids who are in vulnerable situations and need help through the foster care system. Like, that is just not okay. So that was another, I think, big piece that kind of really popped out for me. And I think it popped out for a lot of other people, because there were a lot of shocked looks in the room when those statistics were out. In addition to the full out report, for the people watching on video, you can see it. It'll be in the show notes if you can't. The amazing Stephanie Craddock Sherwood put together the graphics for the report and put together a really fabulous one-page infographic on some of the highlights or lowlights, as they may be, of the report too. So it's a simple, easy way to kind of get a overall glance at the report without reading all 42 pages of the actual booklet.
Right. But if you want to read that, you
Yes.
can. Links, as Jamie said, in the show notes, or you can always go to prochoiceohio.org.
Oh, and this week's Walk of Shame goes to
The return of the Walk of Shame.
Oklahoma. Yeah. So Oklahoma has a lot of issues.
It has some fabulous people in it, but
They
it
do
has
have
some major
fabulous
issues.
People. Oklahoma City is nice. If you go there, go to Bricktown. It's a nice area. But yeah, they have some issues. So their legislature passed a bill which makes abortion a felony. So basically, yeah, you would, if you were a doctor who performed an abortion, that would be considered like a cruel act or an inhumane act, and therefore you would lose
Unprofessional conduct.
Unprofessional conduct.
Yes.
And so therefore, because you were committing unprofessional conduct, you would be in danger of losing your license, and then
you would lose your license.
or you would lose your
Yeah.
license, and you wouldn't be able to be a doctor anymore.
Yeah.
Right.
Is how they're going about that.
Mhm.
I really don't know why they thought that this was a good idea, like what they thought they were going to accomplish. Like, this obviously was not going to go anywhere. It's going to go to court. But anyway, so Governor Mary Fallin, who's a Republican, she's anti-choice, but she did veto it because at least I guess she recognizes that this was just crazy.
Right.
So
Crazy and horribly unconstitutional. I don't get how a state legislature moves a bill. I mean, moving a bill through a House chamber and a Senate chamber takes time and committee hearings and all of that. You know that you're signing your state up for a very expensive court battle. North Dakota did that. That you're going to lose. And so I think that was the point, was that the governor realized that, okay, this is going to require us to challenge this to the Supreme Court. It's not going to win right now. And so she just declined to sign her own state up for that big of an expense, so she gets points for using common sense there, regardless of what her views on abortion are. Financially, it's not a smart decision. I don't get how the state legislature doesn't get that message. Ours has. They were presented with the heartbeat bill, which slightly different mechanics, but same basic principle. And they said, you know what, this isn't something that we can afford to do right now. They wanted to. I don't get how the Oklahoma legislature puts that on their governor's desk saying, hey, we want to buy something really expensive and it's up to you to turn it down.
Well, I think too, it's a really interesting study of which anti-choice group is in power. Right. Because the heartbeat bill would sail through if Ohio Right to Life wasn't opposing it.
Right.
And I think that really just shows. So the Oklahoma bill was the brainchild of an organization called Abolish Human Abortion, AHA. They are actually probably even further out than the groups we talk about with Created Equal, with their Killers Among Us campaign and things like that. They are like the most extreme. They really believe that, the Supreme Court was entirely wrong in Roe versus Wade, and it is their moral duty to overturn it. This incremental approach is not what they're interested in. They want to just ban it outright. Just do it right now.
I think you're being polite in describing them too.
Oh, they're freaking ridiculous.
They think that this is like the second Holocaust.
Yes. Well, they are the new abolitionist movement. They are co-opting all of the language from the anti-slavery actual a movement, and really calling this the next genocide, the next slavery, the next, they are the abolitionists of the 21st century, even though they're mostly white dudes. So put it
I'm
politely.
like, what else is new?
What else is new? So yeah, these are radical groups, and it just really shows that, in Oklahoma, this radical group has control of their legislature and has enough weight, scarily, to push them to pass this bill.
Right.
Yeah, and they would still be able to, win. That's crazy. I also read that Oklahoma is one of the most anti-choice states. There's a woman trying to open up an abortion clinic there in Oklahoma City. Oklahoma City is the largest metro area currently with no abortion provider, and no one has tried to open up a clinic there since 1974.
Yeah.
Yeah. I mean, that's shocking. That's basically like abortion was legalized in 73.
Yeah.
And then immediately after that, they were like, ooh, not in this state.
Yeah, basically.
Yeah, so that'll be really interesting. It's the Trust Women group. They've opened some other clinics around the state and really happy.
I think they have another one in Kansas, which is also very anti-choice. So,
they reopened Tiller's clinic after he was murdered.
Right.
So, yeah, that'll be really good for that area. I mean, when you look at it, Oklahoma is just such a state of disparities. I mean, you've got the kind of...
It really is.
City culture, European immigrants, coming in, but then all of the areas of the Native American reservations where, we've, ghettoized our Native population and all those things. And, for a state like that, where they've got so much need for public assistance and help and those kinds of things, to have the state government say, we don't care about you. We're going to spend all this money, trying to ban abortion is just completely ridiculous.
I talk about like the detrimental statistics for Black people. It's even worse for Native people. Like, it's really bad for them, which is really sad.
Are you allowed to open an abortion clinic on a Native American reservation and still face the same regulations that you would if it was not?
There were some...
I really don't know. I'm curious.
That's a good question.
There was there's a Independent Lens, or is one of the PBS specials did one, because it happened, I think, in South Dakota. Yeah. When South Dakota was talking about its personhood amendment and all those bad things that it was doing like 4 or 5 years ago, a woman on one of the reservations did open a clinic, and there were some different, but there's also all the federal laws that kind of play in some ways, but it was very interesting and weird. I can't remember exactly how it played out. Yeah. But yeah, she did. I mean, that was her solution was going to be if South Dakota did pass this personhood amendment. Yeah. Because it's a reservation and semi-sovereign in the way that we set those things up, she could be able to still provide those services in those areas. We'll have to look it up, and maybe if we can find it real quick, we'll throw it in the show notes. But it was a really interesting kind of case study on what they could do in those kinds of situations, because it is slightly different.
Yeah, I mean, even if that would happen, it's not some miraculous solution for the majority of women, because transportation issues, even in the state of Ohio, is a huge thing, and getting to the middle of South Dakota or Oklahoma or wherever is kind of impractical. Yeah. For any larger number of women. But that's something I'm interested. That's curious. So one last note on Oklahoma before we move on. I just wanted to talk more about the punishments that the bill prescribes. So the state is looking at the doctors that are practicing in their state and saying that if you're a doctor that performs this procedure that's legal across the country, that they are so offended that they will strip you of your medical license and throw you in jail as a felon. They're putting doctors behind bars as felons for doing something that is a constitutionally protected right. And that, I think, is just so astounding to say, okay, we object that this doctor is doing an abortion, but we object so strongly that we're going to lock you up in a prison.
Yeah.
And OBGYNs are already at such a shortfall anyway. I mean, hospital after hospital is getting rid of their birthing centers. I mean, some places in Ohio, you've got to drive an hour to get to a hospital that has a birthing center.
Right.
So, the fact that we're just cavalierly saying we're just going to throw all these doctors in prison.
Right.
What happens when women want to give birth to healthy babies and we've thrown all the doctors in jail?
Exactly.
Right. And making something a felony, even after they're out of prison. Basically, if you're labeled as a felon, you're not going to get gainful employment.
No.
And so saying that this person, this doctor, because he's done something that the woman came and asked for in his legal procedure, is somehow, to be removed from society is shocking.
Yeah. Most likely that probably wouldn't happen. They would just probably stop doing them.
Yeah. In some
Right.
cases.
The doctors would
Yeah.
stop the procedure,
Yeah.
but to threaten that, and then just to transition into the next thing on our agenda, they've applied similar, different states, now talking about Indiana,
Mhm.
they've applied similar punishments to women. And so this past week we saw the oral arguments in the appeal in Indiana in their state court of appeals for Purvi Patel, who has been convicted and is facing 20 not facing 20 years. She is currently serving a 20-year sentence because she had a miscarriage and was charged with feticide and child neglect because she had a miscarriage.
Yeah.
And the hospital performed tests. They say that there was no traces of any abortifacient. They didn't find any evidence of mifepristone in her blood. But still the state has sentenced her. And so she's now doing 20 years in prison because she had a miscarriage. That's equally shocking.
Yeah.
Even more so that, this wasn't something that she chose to have happen. She was pregnant. She had a miscarriage. She went to the hospital and now she's in prison. When this initially happened in March of 2015, there was a lot of criticism of the state of Indiana for doing this, especially on Twitter. People were outraged. They were furious that Indiana would do this. And there was a huge response. Several of the writers from RH Reality Check, some of your more usual suspects on Twitter, were saying, hey, don't look at this as an Indiana problem.
No.
Because many of your states have the same laws and could be in the same situation.
Well, and the crazy thing about the Purvi Patel case, too, is that she, as you said, she's being charged with feticide and child neglect.
Right.
Which are two totally separate sections of code. And also, feticide can only happen before the fetus is expelled from the body. Once it's expelled from the body, it's a child and a person.
Yeah.
Child neglect can only happen to a child who's alive.
Right.
Feticide is the killing of something before it comes out.
Yeah.
So she's being charged with killing the fetus before it comes out, but then also abusing an alive baby afterwards. Those both can't happen under law. But the judge was like, oh yeah, sure, that's fine.
Yeah.
So, and our listeners will remember, and most people will remember, a couple months ago, Donald Trump was like, oh yeah, there should be a punishment for the woman. There has to be. And every anti-choice group on the planet, except Abolish Human Abortion, was like, oh, no, that's not what we mean. We don't believe that. No. Well, they're already putting women in jail. They're already punishing women. So the fact that they can with a straight face say, we don't want to put women in jail, and you're already freaking doing it. You're doing it with Purvi Patel. You're doing it in Tennessee with women who have drug abuse problems. We're putting women in jail for things they do during pregnancy already. Yeah. And it is not a far cry to say that if one of these bans does go into effect, that we wouldn't put women in jail is just a farce. It's just ridiculous.
Right.
So
women in jail, doctors in jail.
Everybody in jail.
I feel like, except for us, not many people in the media, like when he said that, I don't feel like many of them even brought her up. Like they were just, had all the anti-choice groups on there saying how that's not what they believe and how he's really not pro-choice, but somehow they're all behind him now anyway. And he didn't really mean that. Like, I'm so done with them.
Yeah, you can't have it both ways.
Yes, exactly.
So yeah.
Okay. So there was no actual decision. This was just the round of oral arguments. I believe I saw something where the judge on that Court of Appeals bench did, stress that they understood the timeliness of this, that there was a woman sitting in prison waiting for this. So hopefully there will be a decision in this round of appeals to be announced shortly. But we're in a position to wait and see. So, and I don't think, President Obama is going to be leaving office and he'll issue a round of pardons. I think that because this is not a federal case, that it's not eligible for a presidential pardon.
No, Pence would have to do it as governor, and that's never going to happen.
Yeah, that's sure as hell never going to happen.
Unfortunately.
Right. For those who don't know, Governor Mike Pence used to be Congressman Mike Pence and led the fight the fight to try and defund Planned Parenthood at the national level.
Yeah.
So he's probably not going to side with Purvi Patel.
Yeah.
What's
I
going
so
on?
wanted to, when Donald Trump the other day said he wanted to debate Bernie Sanders and he would do it for $10 million and give the money to women's health issues. I wanted to tweet at him and be like, give the money to Planned Parenthood since all of these states have tried to defund it. Like, and you said before that they do really good work. So you should put your money where your mouth is and give it to them.
Well, he likes
Of
to make
course,
lots
that
of
would never
promises.
happen.
He likes to make lots of promises with his money that he doesn't actually do. They were saying
True.
this week that $6 million that supposedly he raised for veterans, like 350,000 has actually been given to veterans groups.
That's not
Exactly.
6 million.
That's not 6 million. That's
This-
way shorter. That's not even like, that's like 5% of 6 million.
Yeah.
Exactly.
So,
You're exactly right. Yeah.
so yeah, I wouldn't.
Yeah. The first thing I saw this morning when I turned on my phone was a tweet from Hillary Clinton's campaign, and it was a video of, what would your potential next president have to say about pregnancy? And so it was some footage of some Donald Trump interview, and he was basically saying, pregnancy, it's great for the woman, it's great for the man, it's not so good for business. It's like, dude.
That's all he says though. And even when you say things like about that, like even when they said when he was talking about how he was happy that the housing bubble happened because then people like him can go in and buy, like, and then he was just like, well, I'm a businessman, like that's what we do.
I'm actually care about people.
Like, okay, like that makes sense.
I mean, he's correct. That's what they do. And those are
Yeah.
horrible things.
Yes.
Yes.
And that does not make you a qualified candidate to
No.
be president.
No.
Gosh, yeah. Crazy.
Okay. What's our last segment, Randy?
Let's get it on. Yay.
Okay. First up in Let's Get It On, we did our microphone training. That's the training that we've talked about in previous episodes of this podcast. It's going to be a program that's ongoing. We want to have people sign up just because the first training is over. There will be additional rounds. Making sure that people who want to get more engaged, more active, know how to talk about issues of reproductive rights, to write letters to the editor, write op-eds, do call-in radio, that sort of thing. So continue to sign up if you're interested. You can find it at bit.ly/microphone2016.
Cool. Also, we also had the Women of Color Happy Hour Roundtable, and I was very happy with the people that came. It was small, but we had a good time, and we had a really great discussion, so that went really well. And also upcoming, so next Saturday, the first Saturday in June, is Dayton Pride. So we're going to be there from noon to 4, and we'll have a booth set up. The third weekend, which is, I don't have
The
my
18th.
The 18th.
Yeah. The 17th, 18th. It's Father's Day weekend.
Pride.
Until I remember.
Yes. The 17th and 18th, Columbus Pride. We'll be there Friday, 4 to 8, and then all day Saturday, 10 a.m. to 8 p.m. And then the last weekend in June is ComFest and Cincinnati Pride. So we'll be at ComFest Friday, Saturday, Sunday. Cincinnati, that Saturday, June 25th. Of course, you'll have all of that information in an email, or you can email me at volunteer@prochoiceohio.org.
And for folks in the northern part of the state, for some reason, Toledo and Youngstown and Cleveland all do their prides in July and August. So Annie has a bunch of like little street festivals and those kind of things she's doing. So if you're interested in volunteering up there, email volunteer@prochoiceohio.org, and Annie will get you hooked up with that schedule too.
Yep. And as always, look for information in the show notes.
Cool.
Good to go?
Good to go.
Okay. We'll see everybody next week.
Bye.
Bye.